Hey everyone, thanks for joining us today. Bo and I are here again having a chat, this time about a topic called therapist ownership, which is really another way of saying taking responsibility for our job. Bo, this is something we chat about a fair bit. It's something we have conversations with other people about a fair bit. And we often hear excuses made by people about, that's not my job, I shouldn't have to do that. I always refer on for this. And I wasn't trained to do that, and all these kind of phrases that we often hear in our education space, but also in clinical practice. What are your thoughts around this?
Yeah, it's a big one, and I think when you do start to take that bit more ownership as to, for example, if someone's not doing their exercise and you blaming it on them, saying, well, why didn't you do it? Well, is there something that we missed? Was that exercise not didn't fit in with their lifestyle? We didn't look at other factors that may be involved. Did they not enjoy it? What else could it be? Not necessarily the complete shifting that responsibility and the blame onto the patient, when it really is the teamwork environment, and you've got to think, well, what could I have done differently, or how could I improve on that?
Yeah, I think you're right. And I use a phrase that it's everything's my fault, and that can be taken in the positive or the negative way. If a patient comes in, like you said, and they're not being compliant with their exercises, well, if I look at that as that being a fault of mine, like, what could I do better next time to emphasize the importance of those exercises for the person, emphasize the need for them to do it, emphasize the potential outcome if they don't do them. So if they're not following my instructions, maybe it's not the student, it's the teacher. Am I not educating them around why it's important? In the same way that if I don't get the results that I'm after in a particular treatment, and the person has to come back and see me multiple times, well, then that's my fault. I probably didn't design and develop and implement the best treatment possible. On the flip side of that, of course, you've got the positive side, which is patient has a great reaction to the treatment, great response. Well, then that's my fault. I could look at it like that too. Or they are compliant and they do follow my instructions and advice and they get the great results, that could be potentially seen as my fault as well. So I think this is what we mean by taking ownership of the entire process. We are a leader, right? We have the patient who is coming to us for a service. They are putting their time, their money, and their needs in our hands. And we are the person that's supposed to lead them down the path that they want to get, that leads them to where they want to get to. And so it's our responsibility, it's our fault, is the upshot of it all.
Yeah, and I think a lot of that as well comes back to a process of reflection. If you can really reflect on how that went, what you could improve on, where are the gaps in your knowledge and understanding that you need to then go and focus on? Because if you might get, let's say, you get 10 patients, 9 of them you've done an awesome job, but one didn't get a whole lot better. Well, you got to think, well, what am I missing? What do I really need to learn a little bit more? Why did I choose that particular treatment plan? Whatever it may be, really taking that time to reflect on each individual patient, each treatment plan, and over a day, over a week, over a month, whatever it may be. I think that's quite a useful thing to do.
Absolutely. And look, I think the days of someone saying, look, I can't find that information. Someone comes in with a particular presentation, or they're on a medication you've never heard of, and you're like, oh, I don't know what that is. The days of that excuse is gone. They're gone. Every piece of information you could possibly want on just about any topic is available to you immediately on the internet. Like, it's right there. And there's no specialized skills or abilities that you can't go and learn from somewhere, either face-to-face or online. It's everywhere. Like, you can find these things.
Yeah. And, I often see this when people say, oh, it's not my area, or it's out of my scope, whatever it may be. And, you might take it, for example, a neurological presentation. You might not be the best at it, but you sure as hell want to do the best assessment, really understand what's going on, so you can write the best referral, so that when someone does receive that referral, they get a pretty good understanding of what's going on, rather than just saying nerve pain. you're not going to get a response back from that practitioner. You're not going to build a good sort of relationship with them. So whether it is in your scope, out of your scope, you still need to know a lot about different areas. And yeah, you might not have learned it in your undergraduate training, but go out and learn it. As you said, there's resources available everywhere. You look at PubMed, Pedro, there's all of these research databases, there's YouTube, there's podcasts, there's a range of different resources, including more formal education. Take that time to start to learn about areas that are perhaps a weakness that you don't know much about, rather than only focusing on things that you're good at and getting really good at those. You still want to be, keeping your knowledge up to date in various different areas.
Oh, you touched on scope of practice, this is a big bugbear of mine. Scope of practice is very important. Like, we all have a certain qualification, a title, if you want to put it that way, that allows us to do certain things as defined by the training that we have received. That scope of practice can be broadened. Everybody's ability to do more is limitless, right? And so we have an insurance policy that sits over the top of our scope of practice that says there's certain things you can't do. Cool, right? There's a whole bunch of manual therapists out there that can manipulate joints and some that can't. And so there's a very defined line of scope of practice there, but there is so much you can do on either side of that line to be able to help a patient with both assessment and treatment. So scope of practice is limiting to a degree, but it doesn't have to limit your understanding and knowledge of something. So you might not be qualified to provide manipulation, joint manipulation, but like you said before, you can damn sure understand it. You can go and, understand what is involved in that, why it's useful in some situations and not, where are the dangers, where are the risks, really know all the different things that you should know. And then when someone comes and asks you a question about, should I go and see a chiropractor, an osteopath, a physio for this neck problem, I think maybe needs to be adjusted or something, you can make an informed decision. You can make a functional decision about that question and apply appropriate advice or guidance around that, rather than say, look, it's not something that I'm trained in, it's not something that I know. That's a cop-out. Like, if you want to be at the top of your game, if you want to be known as someone who's really good at what you do, have a broader understanding and expand your scope of practice, or at the very least, expand your scope of understanding.
Yeah, that's a really great point where we really, like, if there's an area that we don't know much about, there'll usually be more fear. So if someone comes in with an imaging report and there's all of these medical terminology and diagnostic labels on there, it can start to ring alarm bells from a patient point of view. But if you as the therapist don't know much about it either, then there'll also be that element of fear there. And, I'm not going to touch your neck because I've seen osteophyte formation, degenerative changes, disc desiccation, a range of different things. When you look at it and think, well, actually, I know a bit about that, and I've looked at some research, and I know that a lot of these changes are actually quite normal changes. Given that they're a 65-year-old male, I would expect that anyone over the age of 40 is going to have some degenerative, normal age-related changes. So using that as an opportunity just to say, well, you might not be an expert, an orthopedic surgeon, sports physician, whatever. Having that little bit of understanding on this current evidence to say, well, look, based on this evidence, based on my understanding of this area, these are pretty normal changes. So not evoking added fear that's unnecessary, then the patient goes away and is either in a heightened sense of, oh my God, I just saw a therapist and they were quite concerned about it. Their levels of fear and anxiety tend to go up. So just having that bit of understanding about different areas that can really help to use that as an educational tool to help de-threaten and decrease a patient's fear.
That's right. So much of what we see walk through our doors clinically is driven by internal processes in the patient's head, like what they're thinking and feeling about their presentation. Someone tears a meniscus in their knee, and they've guaranteed they've heard of someone or know someone who's injured a meniscus, and they've seen what's happened to that person's sporting career and their activities of daily living, and they just assume that that's going to happen to them. They probably haven't met someone who's torn a meniscus and has had very little to no changes to their activities of daily living, even though we know that happens. You know, you can have two different people have the same injury and have completely different outcomes, but because we know one story, we'll follow that story. And so our job as a therapist should always be to go, look, here's what's happened. There's a number of different things that could happen now as a result. There's a bunch of things that you can do to improve the potential for this. Things that you can do to reduce that pain and inflammation, all the negative kind of things that you might experience, so that maybe you can avoid surgery, you can avoid ongoing pain and the need for treatment, and you can probably manage this yourself in most cases. And so just really, and we can't do that though. This is the key thing, right? We can't do that unless we have a really broad and deep understanding of pathology, of clinical styles of communication and language, and of the human body. Like this is our job, right? Imagine a mechanic who doesn't know what that particular bolt in your engine is for, or what that dial over there is telling you. Like you go to the mechanic, you pay them for their knowledge and skill to be able to manage everything in your car, right? Now, no, if the mechanic turns around and says, "Oh, look, I don't work on fuel injectors," we go, "Well, okay, what am I doing here then? I need to go somewhere else." Now, there's going to be some mechanics who specialize in certain things, and that's why we have specialists in our industry, right? So we can refer off for the very specialized things. But I think if you want to be a great therapist, you've got to be, to a degree, a bit of an all-rounder, and then go narrow if you find an area that you're really passionate about. But you've got to be able to answer those general questions from people.
Exactly. You know, often we are the first contact. You know, when you think about someone that presents with any musculoskeletal pain or pathology, they'll often present to us as a first point of call, or the last. You know, it depends on the process that they've been through. But, you know, they will present with all of these musculoskeletal disorders. And when you start to think about the perception from a pain point of view and a psychological point of view, if someone presents with the word tear or arthritis, they often fear the worst. Like, I don't want to move, I don't want to make it worse. But if you can use your understanding to say, well, do you know what? These injuries, pathologies, they respond really well to movement and exercise. Not to say that, you know, if you exercise, it's going to completely snap, because there's been extensive research in different areas in the body, and even spondyloarthropathies that, you know, people are quite fearful of around axial loading in the spine, that, you know, they can respond really well to high intensity training. You know, knee osteoarthritis, the same sort of thing, where people tend to be a little bit more hesitant, fearful, protective of that area. If we understand what the evidence is saying, you know, remove that fear, get them moving, get them active, without saying, oh, this sounds really bad, because it does. It's threatening inflammatory information that you see on imaging reports and, you know, the previous diagnosis, to say that, you know, look, let's work through this. Let's, you know, the outcomes can be pretty good. So I think the key there is just to really not be so fearful of this terminology, and putting it in less threatening terms. And that all comes back to knowing more about that area, or research in general, and information in all aspects of what we do as far as musculoskeletal pain.
Yeah, no, you're 100% right. And there's probably people listening to this going, yeah, great, that all sounds good in practice. I've tried that with my patients, and they come in with these really complex problems. I can see they're terrified about the potential outcomes of this. I don't know quite what language to use or what angle to come at it from, and I'm not really familiar with that spondyloarthropathy, and how do I manage that, and like how do I describe, like, I don't know what to do. And then they just go, well, I'll just go back and I'll just do what I've always done in my treatments. And, you know, the majority of people get good outcomes, so be it. That's okay. That's all right. But if you want to be really good at what you want to do, at what you do, it's time to remove the excuses. We've got to take ownership of this. We've got to say, well, where are the gaps in my knowledge? I know I had a stack of them when I came out of school, out of uni, college. We all did. There's not a single university or college program out there that is flawless and has no gaps. I know, I've taught in a bunch of them. There's heaps of them. There's heaps of gaps. There's no end to the amount of professional development and personal development that you can do to fill those gaps. And the people that are investing time and money and effort into doing that are the ones that are going up in their knowledge. They're the ones that are increasing their knowledge and ability. And that just pays dividends for the patients, pays dividends in your own satisfaction in your work. There's nothing more satisfying than going to work knowing that each day you are getting better at what you're doing and the outcomes are getting better. So if I can say one last thing, would be no excuses, complete ownership. We got to set the highest expectations for ourselves so that we can provide the highest quality of service to our patients. Everybody wins.
I agree.
You agree? All right, cool. Let's leave it there. Thanks, Bo.
Cheers.
Bye.